Alterations in cognition and sensation, dementia, and thought disorders. We have two main thought disorders that we're talking about. That's going to be our delirium and dementia. We have changes in mentation and cognitive impairment that can occur at any time in life. Cognitive functions will change with age, usually affecting the short term memory and the learning ability. It doesn't mean that they will disappear, but it just means that it may take a little more effort on the part of the adult to be able to recall information or to learn new information. Cognitive functions, or I'm sorry, the older adult is going to be at the greatest risk for cognitive impairment. But understand that this is not a normal consequence of aging and it should not be considered untreatable. It is important to realize that depression and other medical disorders can manifest as a mental dysfunction. So, true or false? Mentation occurs only in advanced, and mentation changes occur only in advanced age. And we know this is false. It can occur at any time in the life cycle. So, delirium is defined as a sudden and transient state of confusion, meaning that it comes on quickly, but it doesn't usually stick around. Older adults sometimes will experience delirium or confusion as a first symptom of disease or infection. So, if you have someone that is normally very cognizant, very alert, and aware of what's going on around them, all of a sudden they're now confused or they have a significant change in their level of consciousness. Consider that it might be an infection. It can also be a medication or the symptom of a disease. Symptoms include difficulty processing information, disorientation, impaired judgment, a poor intellectual capacity, suspicious, frightened, or inappropriate behavior. It can be caused by a high fever, head trauma, a brain tumor, drug intoxication or withdrawal. It might be a metabolic disorder or inflammatory disorder of the CNS. Again, it might be uh, medications. And it may also be the only symptom that presents for an infection or a response to some medication, such as anesthesia in the older adult. Treatment: we need to treat the underlying medical condition. Again, this will usually resolve, but we also need to make sure the client stays safe. Dementia more commonly affects older adults. It is a gradual, irreversible decline in memory and other mental functions, and it can affect the individual's daily life. Disorders that are characterized by dementia are Alzheimer's disease, cerebrovascular disorders, and Parkinson's disease. Alzheimer's disease is the most common cause of dementia, and it is a progressive, deteriorating brain disorder. There are two types. We have early onset and late onset, which is the most common. There is an increased risk of early onset with first degree relatives that have Alzheimer's disease, or there are some inherited genetic abnormalities. Causes of late onset dementia might be a combination of lifestyle, genetics, and environmental factors. Four pathologic changes happen in the brain. We have a decreased cortex size, deficient acetylcholine, which explain the cognitive deficits and the altered emotions, neurotic plaques and neurofibrillary tangles, are also related to the disease manifestation severity. So we see three basic stages with Alzheimer's. We have preclinical, where the changes are made in the brain, but no symptoms are actually seen. We have mild cognitive impairment, where the client's still able to live independently, but does show some memory deficits. And Alzheimer's dementia with significant cognitive decline. The classic symptom is going to be memory loss with an insidious onset, impaired long term memory, an inability to make appropriate judgment, problem solving ability declines, there's behavior disturbances or personality changes, and depression. In the advanced state, we see deterioration in memory, cognition, awareness, self care. These clients may begin to wander. They may have periodic violent behavior. They may experience aphasia, alexia, agraphia, acalculia, agnosia, ataxia, and tremors, and apraxia. We can diagnose this with electroencephalography, CT, PET scans, MRIs, and there's a new diagnostic called NIMOX AD7C. There is no cure for Alzheimer's. Supportive treatment is what we need to provide. There are some medications that are available that can slow the progression or improve the symptoms for a period of time in some clients. Folic acid supplements may be beneficial, as well as antidepressants and tranquilizers. So, a couple of the medications, we have the cholinesterase inhibitors that is given to the Alzheimer's client to enhance and maintain memory in the mild to moderate disease. The drugs that we're talking about in this category would be like our donepezil. We also have the NMDA receptor antagonists that are given for Alzheimer's disease. This drug in this category is Namenda. So as nurses, it's really important to help maintain the client's independence in their home environment for as long as possible. And then we'll refer them to an extended care facility if or when it is appropriate. We need to provide as much continuity in the life of these clients as possible, including the people that they're in contact with, the places that they are, the routines that they have, etc. Changes in any of these can actually exacerbate the confusion or exacerbate undesirable behaviors. We should minimize choices. In other words, instead of opening up the closet door and saying, "What would you like to wear today?" pull out a couple of outfits and say, "Which one do you want to wear?" Never argue with them or agitate them. These clients may still remember how to do simple tasks such as shaving or folding laundry or what their favorite foods are, etc. And we should encourage this as much as possible. We also need to provide emotional support to the caregivers. We should also assess for client safety and assess how much of a burden is on the caregiver. For nutritional support, as the client progresses in the disease, they lose the ability to manipulate and utilize eating utensils. So, finger foods are often given so they can actually feed themselves. They just feed themselves with their fingers and make sure that they're getting nutritious fluids. Assistance might be required. Uh, it may just be the extent of Don't forget to take a bite, or take a bite of this, or don't forget to swallow, because sometimes they will even forget to do that. Um, in the later stages, feeding tubes might be required. If there's no reason that confused patients need to stay in bed, don't make them stay in bed. Let them get up, let them wander, but let them do it safely. If they are prone to injury because they're wandering, then try setting them in a chair, or even let them visit the nurse's station. Sometimes agitation from these clients is an indication of pain, hunger, stress, fear, or even the need for toileting. So we need to make sure that these are not issues if a client becomes more agitated than normal. Again, offer limited choices to simplify decision making. Make sure that environment is safe to allow these clients to wander rather than trying to keep them from wandering. Encourage self care at whatever level the client can function. Some strategies that work with children often will work well with dementia clients. These clients deserve to be treated with dignity, regardless of their abilities or behaviors. True or false? Alzheimer's disease presents in two forms. This is true. True or false? The goal of Alzheimer's disease treatment is to place the client in an extended care facility as soon as possible to maintain his or her safety. This is false. And your post test.